Welcome back to another episode of Dr. Plano's Plastic Perspective. Today is January 24th, and I'm Dr. Jeff Angobaldo, board certified plastic surgeon. Today we'll be discussing our perspective on body contouring surgery, specifically arm lifts and thigh lifts. When patients lose weight, usually it's substantial, over 75 pounds, and also there's a contribution of genetics. People will have loose skin in their proximal arm as well as their inner thigh. And you can work out as much as you can, and that will help a little bit. But when you have loose skin that's damaged from weight loss, that doesn't really tighten up that well. And the only treatment is surgery. The surgeries that we perform for the loose skin in the proximal arm is called the brachioplasty. And in the inner thigh, it's inner thigh or medial thigh lift. They're both kind of similar procedures because there's like 3 different types of incisions for it. When you're looking at someone's proximal arm, if someone has loose skin in just the upper third of that arm, you can just get away with using a small like armpit crease incision. When you have loose skin along the proximal middle third of that upper arm, then you're going to have to create like a little T incision. You have that horizontal incision and with an extension to the middle part of the arm. And lastly, if you have loose skin throughout the entire proximal arm, then you got to think about doing the extended brachioplasty, which is an incision from almost like the elbow all the way up to the armpit area. And that's the most invasive of all the surgeries. With the thighs, it's very similar. If someone has loose skin in that proximal thigh, we're making a small, banana-shaped incision, crescent-shaped incision, where we're excising that loose skin proximally. If someone has a little bit more loose skin that's proximal and extending into the middle of the upper thigh, then we will then perform like a little bit of an extended inner thigh lift where we extend the scar along the middle part of the thigh. You still have that crescent-shaped incision and closure around that groin crease region, but it extends into the middle thigh. Now, if someone has loose skin throughout the entire inner thigh, the proximal, the middle, and by the knee area, the medial part of the knee, then that will require a longer extended inner thigh lift to really correct all that loose skin. So it's very similar to the arm. Our approach is the arm and the inner thigh are very similarly approached depending on where that loose skin is located. The arm lift is also known as a brachioplasty. And as we mentioned, that surgery involves removing excess skin and fatty tissue from the upper arm. It really tightens that skin, creating a very smooth contour and a very youthful appearance. So this skin can be damaged with just weight loss most of the time, but also genetics and age take a part. If people have multiple fluctuations in weight throughout their entire life, gaining 10 pounds, losing 10 pounds, that will also affect the skin tone. We always recommend that after a weight loss surgery that the patients have a stable weight for at least 6 to 12 months after their surgery. Because if they're continuing to lose weight after the procedure, it can result in loose skin. So we always recommend getting down to your happy weights before you commit to any surgery. The longer incision, as we mentioned earlier, the extended brachioplasty, the incision is made along the posterior aspect of the arm, and the incision starts literally from the elbow all the way up to the armpit region. And you're taking out more tissue because people are more loose in the proximal third of that arm. So it starts out being very narrow initially and gets wider and wider, even and the widest point is around the armpit crease, the proximal third of the arm. For some patients, liposuction is performed, but other people just have just loose skin. And so, it depends on how much there is to lipo. But if you're lipoing, there's higher risks of complications, and that has to be discussed with your surgeon. Because when you're lipoing someone, they swell more. You're also affecting some of the blood supply. So it can be done conservatively. Most patients experience bruising, swelling, a little discomforts for a couple of days. We usually start with compression garments. Usually after a couple of days, we initially, in our patients, we use a kind of a Curlex and ace wrap until about a week later. Then we'll switch them out to an arm compression garment. The key with the brachioplasty or even the inner thigh lift is really, you can't really do much like exercise for at least 4 to 6 weeks. Every surgeon is different with their recommendations. Just follow your surgeon's recommendations for that. But the key with brachioplasties is not to really flex your elbow too much. People do have to wash their hair, they have to eat, so you're going to be, flexing the arm a little bit, and that's okay, but not all the time. And to be, because the skin doesn't really get that strong for at least 3 weeks, 3 or 4 weeks. So that's why as the weeks go on, you're healing, and then you can start doing more activities, usually by the 4 to 6 week mark. Some of the misconceptions about arm lift surgery is that it leaves big, visible scars. There's 3 different scarring. Obviously, the extended brachioplasty is the longest, but usually it's all about genetics. So if patients look at how they've healed from other surgeries, whether it be a gallbladder, appendix, previous cosmetic surgery, you can tell how you're going to heal with any scarring, especially with the brachioplasty. So that's always an important discussion to be made with our patients at the consultation. But there's ways to treat scars. If a scar gets thick, it usually doesn't occur in the beginning. It usually occurs 4 to 6 weeks later. So we always advise our patients start using silicone sheets 23 hours a day. And if it starts to get thick, to come to the office, we can inject them with steroids. Those are the 2 main treatments to avoid and to prevent scars from getting thicker. Similar to a arm lift, the thigh lift, the inner thigh lift, it's the same design. It's to remove excess skin and fat from that inner thigh region. We remove skin, the fatty tissue, and just removing that skin, which has become lax through weight loss, provides a very nice result for our patients. The incision is placed, it's very well hidden around the groin crease, but also if we extend the incision down to the middle part of the inner thigh, it's very medial, so it's very well hidden. The scar that doesn't hide that well is when it extends all the way down to the knees. Like if you're sitting, you will be able to notice that scar. But some people need that scar. If you have loose skin around the knee area, just doing a conservative excision of skin proximally is not going to correct and address those particular issues. So if someone has loose skin, extending down the entire inner thigh into the inner knees, and that's where the extended inner thigh lift is performed. Very similar to arm lift surgery, swelling and bruising are common. Sometimes liposuction is performed along the anterior thigh and more conservative along the inner thigh. Like when you have bulkier thighs, if you're just rejuvenating the inner thigh and not addressing the anterior thigh or outer thigh, they may not look quite right. You may be very full around that area anteriorly or the outer thigh, while the inner thigh looks flat and smooth. So sometimes you have to address the entire thigh, not just one particular aspect of it. For all of our body contouring surgeries, arm lifts or inner thigh lifts, patients are always advised you can't really work out for like 5 to 6 weeks. Get a very high protein diet, take your vitamins. All that will assure like better healing and recovery. We mentioned scarring. Usually at 4 to 6 weeks, we start with silicone sheets, and steroids are given, injected as needed if a scar starts to get thicker. It's called a hypertrophic scar, and that can really stop the process. I look at thigh lifts as tummy tucks. It's a similar recovery time. Before you can start working out again, it's about 6 weeks. And there's always complications that can occur with any surgery. One of the risks is infection, bleeding. Infection doesn't really occur too much, but seromas can occur after liposuction. Hematoma is a blood collection that can occur. But what I've seen in my practice is sometimes people can have some rejected sutures or small wounds, especially at the T-junction. The T-junction is where the groin crease meets that vertical skin incision that goes all the way down to the knees. That's the area which has the weakest blood supply. So If someone does have a wound, we'll see our patients every week until things heal. Usually it takes between 1 to 6 weeks, depending on the extent of the wound. People ask if they can combine an arm lift with a inner thigh lift. Of course you can. It's a little bit of an uncomfortable recovery, especially when you're operating on someone's arms, because you can't really get that comfortable if you're having pain and discomfort in the inner thighs and then the arms. But it can definitely be done um, together. The only thing that we use for recovery for arms is the hands do swell. So we always tell our patients to lift their arms up, elevate with a few pillows so it's above your chest. Do that for at least a week. And with the inner thighs, we always worry about clots that can form, blood clots in the veins. So we'll tell our patients to ambulate every 2 or 3 hours while they're awake, and that gets the blood circulating. We always, especially with weight loss patients, all of our patients get cleared by their primary care doctor. When you think about a weight loss patient that had like some type of surgery, a gastric bypass or a banding or a switch, any type of weight loss surgery, I always worry about like if they're getting enough nutrition, if they're getting enough proteins or their vitamins. So we always tell our patients, obviously they get cleared, we check labs, but in addition, like to just to make them a better surgical candidate, we'll make sure that they take their multivitamin every day, some vitamin C, zinc, and a high protein diet. Normally, you need 30 grams of protein a day, just a daily need. But when you're working out and building muscle, some of those trainers will say take at least 100 to 150 grams a day. Take more macros. For all of our surgical patients, we'll tell them to take 100 to 120 grams of protein a day for 2 or 3 weeks before surgery. Take their multivitamin, vitamin C, and zinc. All that would ensure that they decrease their risks of complications, which still can occur, but if you can prevent a lot of issues by just taking good care of yourself before surgery. Obviously, no smoking, and that's essential, because what nicotine does, it vasospasms some of the arteries. So if you're clamping down your arteries, you're getting less blood flow to the area, so you're not able to heal. So smokers have a higher risk of infection and also wound separation, because you can't heal, so they open up. And then if you can't heal, you need good blood flow to stop a bacterial infection. So smokers have a higher risk of infections also. So definitely no smoking, and don't be around secondhand smoke either. When people have unfavorable scars, like a thicker scar, we can treat that. As I mentioned earlier, silicone sheets, injections with steroids, but scars do change for 2 years. Any scar in your body from head to toe. So just with time, a lot of scars will definitely improve. They have no color. But in the first couple of weeks, they start getting really red on people who are fair complected. People who are darker skin tones will get brown scars, but where they're red or they're brown, they get lighter over the next year to 2 years. But there's lasers that can help get the red out, and as well as the hyperpigmentation that can occur, get the brown out. So there's a lot of other treatment modalities that we have in our office to help treat scars. Typically, arm lift or inner thigh lift really lasts a very long time. It's not one of those things that last 10 years like a facelift. These will last a long time. But it's not going to last a long time if someone's going to gain weight and lose weight again. It's because loose skin can result. These surgeries for body contouring really improves the appearance of the arms and the thighs. It just provides a very nice contour, youthful look, and a lot of their concerns of lax, loose skin is addressed. And if patients are happy, then it's a successful surgery. So both the arm lifts and thigh lifts offer very transforming results for patients dealing with excess skin. It's essential that, anyone that's considering this surgery, make sure they consult with a board certified plastic surgeon and they can help create a really good surgical plan. And that wraps up our perspective on body contouring, specifically arm lifts and inner thigh lifts. If you have any questions, you can come in for a consult. You can find us at drplano.com, or you can call us at 972-378-3870. Hope you all have a wonderful day, and we'll see you all next week.